welcome to the OCMCA briefing for March 2025. We got a couple things that we're going to talk to you guys about today. BVM uses for overdose, the ACR protocol, C-collar use for patients above the age of 65. Going to hit a little bit on the transport matrix and the transportation protocol. These are all things that PSRO has discovered, or we've discovered through some studies, or just some patient care reviews.
BVM usage for overdose. Whenever you come across a potential or real overdose, the first thing you want to think about is basic skills. You need to be ventilating the patient. BVM should be the first thought that comes to your mind if you have a potential overdose patient.
And it's really nice when you give them a little bit of oxygen because it removes some of that hypoxia. And when you give them your Narcan, they don't come up swinging. We're doing a study on ACR usage. Now, ACR stands for Ambulance Child Restraint, which is part of a CRS, which is a child restraint system, like your car seats. However, the state of Michigan, when they wrote Protocol 4.8, indicated all pediatric patients must be transported in an ACR. So that means you can't use the patient's car seat. You can't use other devices. It has to be an ACR, according to the state. So what this study is looking at is, first of all, is it being documented? The protocol indicates that if you don't use it, you must document why you didn't use it. However, if you forgot to document why you didn't use it, we have no way to know whether you used it or not. So part of this study is anybody that does not document it, we're contacting their EMS coordinator. And the EMS coordinator is then discussing with the crews whether it was used or not. And what we're trying to determine is, first of all, what is the overall protocol compliance with this protocol? Secondly, how often is it being documented? But probably the most important part is, why is the ACR not being used? Currently, the state has told us that they are unwilling to adjust the protocol. However, our hope is through data that we will be able to give some data-driven improvement suggestions to make the protocol work better for all of us.
This is just a reminder of the use of C-collars on patients over the age of 65. Any patient that is over 65 that has any indication of a head strike needs to have a C-collar applied. And if they refuse, you need to get a refusal from them.
8.3 transportation protocol has not changed, but we have had some cases where we figure we need to do a reminder out to all of our providers that when you transport a trauma patient, you really do need to think about the criteria. If this patient falls into red criteria, they must go to a level 1 or 2 trauma center. Remember, level 1s and 2s are equal in the EMS world. Now, the biggest thing here is that if the heart rate is greater than the systolic blood pressure, then you must go to a level 1 or 2 trauma center.
That's somewhat nuanced in this protocol, and we just wanted to bring light to it for everybody. And then the yellow criteria, this is just on here to remind you, these are for level 3 and 4 trauma centers.
If you haven't taken a look at the transportation protocol, which is 8.3, or the transportation matrix, which follows the transportation protocol, take a look at it. There's some changes on it. More importantly, if you have a burn patient, specifically a child, a pediatric patient that has been burned, one hospital that you can go to is Children's Hospital with your pediatric burn patient. They have been added to our transport matrix, as you see on the screen.
Thanks for listening. This is Amy.
Thanks again, everybody. And if you got any questions, this is John. You can contact me, Bonnie, or Amy, and we'll be able to help you out.
Have a great day. Thank you so much for listening.
If you're interested in more of the clinical perspectives on some of these topics, Dr. McGraw is going to be joining us in the near future to do a little bit longer discussion on some of these topics. That'll be available in some of the upcoming months. Thank you, everybody, and thank you for what you do.